In today's video, we're going to go over the 4 biggest regrets that I hear from retirees regarding their health care coverage. I've been a fee-only financial advisor for over 20 years, and one of the challenges with health care mistakes is they tend to be expensive and they tend to be difficult to reverse. So I don't want to see you make those mistakes, so let's jump in. And the first one is people share that they wish they had understood the concept of who pays first with their healthcare coverage. Maybe you're still working, maybe you're over 65 years old, or you're on your spouse's healthcare plan. And you think, well, I don't need Medicare. Well, that can be a really costly mistake for a couple reasons, the second of which we're going to talk about next. But the first one is just the concept of who pays first. Just because you're on a group plan, if you're over 65 years old, there's the concept of, well, Medicare is going to pay first if the group plan is coming from an employer that has more than 20 employees. So if Medicare is supposed to pay first, you could find yourself in a situation, if you didn't take Medicare, where your group plan is saying, well, we're not going to pay this. It first Medicare pays, and the things that they don't cover, then the group plan covers. So be really careful there, because that can rack up dollars very quickly, and it can be very unnerving when you don't know, is anybody going to cover this expense if you didn't sign up for Medicare. So be very, very careful with that, particularly Part B, which is the the medical part. Part A is hospitalization. Before I go on to the second biggest regret, I do want to share, I am not a Medicare specialist. I am not a licensed insurance person. These are just observations as a fee-only financial advisor that I've observed. I encourage you to reach out to a Medicare licensed professional to walk you through these things. The goal of this video is to put things on your radar screen to say, oh, I better reach out to a professional in this area and talk to them. Okay, let's talk about the second item. And the second item is not enrolling in Medicare when you're first eligible. So the way it works is you can sign up 3 months before your birth month. Then you can sign up in your birth month, obviously, and then you can sign up 3 months afterwards. And if you don't do that, there are exclusions. Again, talk to an expert. But in general, I want you to know that if you don't sign up when you're supposed to sign up, there's a penalty. And it's a penalty of an extra 10% per year that you didn't sign up, that you should have signed up. So if you wait 3 years to sign up, yes, you can still sign up for Medicare, but there's going to be a penalty. And in this example, 3 years times 10% per year, you're going to be paying, your premiums are going to be 3 times as high as they otherwise would have. I'm sorry, not 3 times, 30% higher than they otherwise would have been for the rest of your life. It's not just 1 year, it's from that point forward. So again, if you miss it for 3 years and you don't, and you didn't sign up when you should have, you could be paying 30% higher premiums than you otherwise would have for the rest of your life. So just be aware of that. I'm going to give a quick example. If your birthday, let's just say, is in September 6th, then you can sign up starting June 1st for Medicare. You can obviously sign up in the month of December and then 3 months after, so that's October, November, December. So you can sign up from June 1st to December 31st. Again, speak with a professional that knows this. I am not a licensed Medicare specialist or an insurance specialist. Okay, number 3 is when it comes to drug costs. Obviously in the United States, drugs, prescription drugs can be very expensive. And Medicare has a Part D, and it changes every year. So the third mistake is people not properly analyzing their Part D options, the various plans that they can have to optimize it for their particular drug prescription needs and not re-looking at that every year, and or not looking at it separately for, if you're married, for your two spouses. Each of yourself and your spouse can have different Medicare Part D plans. And it can have a dramatic impact on your cost, your annual cost for your drug coverage. And Medicare, I'm gonna put a couple links in the show notes. Medicare has a really powerful site that you can put in your zip code. You can put in the drugs that you take, the dosage that you take, and then it'll tell you, based on where you're going to pick up have your prescriptions filled, whether it's at a local Walgreens, a CVS, mail order, something like that. Here's what your out-of-pocket cost is going to be on these different plans. Now, again, it's complicated, and there are professionals that are licensed that can walk you through that and make sure you don't make a mistake. Know that Medicare's site has a place where you can enter your zip code, where you live, all your drugs, and it will walk you through what that coverage is going to be. But I think it probably makes sense to work with a professional, because it could be, hey, maybe just to use a silly example, I've got borderline high blood pressure, or I've got borderline high cholesterol, and there's a chance, my doctor said, during this next year, I'm going to be on these medications. So you want to be as comprehensive as you can be, just because the cost of drugs are getting to be so expensive. So you want to look at that. Again, if you're married, husband and wife can be on different plans. And again, I encourage you to work with a professional. So the other healthcare expense that I see people regret is not taking better care of themselves when it comes to their nutrition, when it comes to working out, when it comes to their cardiovascular health, when it comes to their muscle mass. As we get older, we start losing muscle mass every year. So even if you don't want to look like Arnold Schwarzenegger, it still makes sense to lift weights a couple times a week to maintain your muscle mass. This applies for both men and women. I think it also makes sense to invest in your flexibility. I like to do yoga, but whatever the stretches are, that's kind of, for me, at least in my late 50s, the aches and pains of getting older have to do with flexibility. And if I do yoga in the morning, it kind of takes away a lot of those aches and pains. So my yoga instructor says, better to feel aches and pains during a 20-minute yoga session or for the next 20 hours. And I think that's wise. Same thing with nutrition. I encourage you to invest both the time and the money to shop and cook healthy food and to eat healthy food. So those are the top 4 mistakes that I see people make. I also encourage you to watch this video up here, which is 8 things that I encourage people to stop doing as they approach their 60s in order to enjoy life more. And it applies to people in their 50s too. I'll see you in there. Thanks for watching this video. Bye-bye.